Welcome to SAT2 Career 2.0 online nursing channel. In today's video, we are going to see 25 important questions for upcoming nursing officer exam AIIMS 2019. So don't skip the video, watch all the 25 questions. Surely it is going to be beneficial for you during the time of exam. If you are not subscriber of SAT2 Career 2.0 online nursing channel, please subscribe it now and click the bell icon to get the latest notification about new videos. Let's see the first question of this video. During an assessment of a patient's abdomen, a pulsating abdominal mass is noted by the nurse. Which of the following should be the nurse's next action? Option A. Obtain an order for a bladder scan. Option B. Measure the abdominal circumference. Option C. Ask the patient to perform a Valsalva maneuver. Option D. Assess femoral pulses. The right answer is option D. Assess for femoral pulses. The rationale is a pulsating mass may indicate the presence of an abdominal aneurysm. Assessing the pulse distal to aneurysm will provide information regarding the degree of circulatory compromise. Increasing abdominal girth may be associated with a ruptured aneurysm. Asking the patient to bear down Valsalva maneuver is appropriate if hernia is suspected. Question number 2. The nurse notes that the following several eye examinations, the physician has documented a diagnosis of legal blindness in the client's chart. The nurse reviews the results of the Snellen's chart test, expecting to note which of the following. Option A 20 by 20 vision, B 20 by 200 vision, C 20 by 60 vision, option D 20 by 40 vision. So in case of legal blindness, the physician would have documented the vision as 20 by 200 vision. The legal blindness is defined as 20 by 200 or less with corrected vision. Glasses or contact lenses or visual acuity of less than 20 degree of the visual field is in the better eye. Move on to question number 3. A client with a history of cardiac disease is due for a morning dose of furosemide Lasix. Which serum potassium level, if noted in the client's laboratory report, should be reported before administering the dose of furosemide? Option A 3.2 milli equivalent per liter, B 3.8 milli equivalent per liter, option C 4.2 milli equivalent per liter, and D is 4.8 milli equivalent per liter. So when you administering a potassium sparing diuretic, you are monitoring the client's potassium serum level. The level which you should take precaution must be option A 3.2 milli equivalent per liter is considered as low potassium level. You know the normal potassium level is between 3.5 to 5.0 milli equivalent per liter. Move on to question number 4. A nurse reviews a client's electrolyte laboratory report and notes that potassium level is 3.2 milliequivalent per liter. Which of the following would the nurse note on the electrocardiogram as a result of the laboratory value? Option A absent P waves. Option B is U waves. Option C is elevated T waves. Option D is elevated ST segment. So in case of hypokalemia, we will note appearance of U waves in electrocardiogram. The rationale, the U wave is a deflection following the T wave. Hypokalemia causes enlarged and prominent T wave on the EKG. Question number 5. A nurse caring for a client who has been receiving IV diuretics suspects that the client is experiencing a fluid volume deficit. Which assessment finding would the nurse note in a client with this condition? Option A, lung congestion. B, decreased hematocrit. Option C, increased blood pressure. Option D is decreased central venous pressure. So in case of hypovolemia, that is the fluid volume deficit due to the administration of IV diuretics, the nurse should suspect and monitor for decreased central venous pressure, which is a better indicator to identify a fluid volume deficit. Question number 6. A nurse is caring for a client with a nasogastric tube that is attached to low suction. The nurse monitors the client, knowing that the client is at risk for which acid-base disorder? Option A, metabolic acidosis. B, metabolic alkalosis. C, respiratory acidosis. Option D, respiratory alkalosis. So when you have a nasogastric tube which is attached with a low suction, the nurse should monitor for the acid-base disorder of metabolic alkalosis. Option B is right here. Question number 7. A nurse reviews the blood gas results of a client with atelectasis. The nurse analyzes the results and determines that the client is experiencing respiratory acidosis. Which of the following validates the nurse's findings? Option A, pH of 7.25 and partial pressure of carbon dioxide of 50 millimeter of mercury. Option B, pH of 7.35, PCO2 of 40 millimeter of mercury. Option C, pH of 7.50 and partial pressure of carbon dioxide of 52 millimeter of mercury. Option D is pH of 7.52 and partial pressure of carbon dioxide of 28 millimeter of mercury. The right answer is you should validate the finding with option A, the pH of 7.25 and partial pressure of carbon dioxide of 50 millimeter of mercury that will be commonly experienced by the client when he is having a respiratory acidosis due to atelectasis. Acidemia is documented by the presence of decreased pH of less than 7.35 on ABG analysis, the presence of an increased partial pressure of arterial carbon dioxide of more than 45 millimeter of mercury indicates the respiratory etiology of the acidosis. Question number 8. A client has a radium implant for cancer of the cervix. Which information is important for the nurse to teach the client during the presentation of discharge instructions? Option A, limiting daily fluid intake. Option B, continuing a low residue diet. Option C, returning for medical follow-up care. Option D is taking daily multivitamin supplements. So, what is the best instruction to be given by the nurse at the time of discharge for this client? The right answer is option C, returning for medical follow-up care. We cannot limit the fluid intake daily until there is a renal or cardiac pathology. The continuing in a low residue diet is advised when the radium implant is present in other than cervix, particularly in the colon. Daily taking multivitamin supplement is not appropriate to this question. Now move on to question number 9. A nurse is preparing to change the parenteral nutrition solution bag and tubing. The client's central venous line is located in the right subclavian vein. The nurse asks the client to take which essential action during the tubing change? Option A, breathe normally. Option B, turn the head to the right. Option C, exhale slowly and evenly. Option D, take a deep breath and hold it and bear down. So when you are going to do the procedure, the nurse must advise the client to do deep breath, hold it and bear down. Whenever the parenteral nutrition tube is going to be changed, advise the patient to do this activity which help in easy insertion or tube. Question number 10. The nurse is making initial rounds of the nursing unit to assess the conditions of assigned clients. The nurse notes that client's IV site is cool, pale, and swollen, and the solution is not infusing. The nurse concludes that which of the following complication has occurred? Option A, phlebitis; B, infiltration; C, thrombosis; D, infection. So when you note the following signs, the nurse must conclude that these are the signs and symptoms of infiltration. Option B is right. Question number 11. A client has just undergone insertion of central venous catheter at bedside. The nurse would be sure to check the results of which of the following before initiating the flow rate of the client's IV solution at 100 ml per hour. Option A, serum osmolality; B, serum electrolyte levels; Option C, portable chest X-ray film; Option D, intake and output record. So at this time, the nurse should check. The right answer is option C, portable chest X-ray film indicates that tube is in correct place or not. Question number 12. The nurse has received a prescription to transfuse a client with a unit of packed RBC. Before explaining the procedure to the client, the nurse asked which initial question? Option A, have you ever had a transfusion before? Option B, why do you think that you need the transfusion? Option C, have you ever gone into shock for any reason in the past? Option D, do you know the complications and risks of transfusion? So, before transfusing a packed RBC, the nurse should ask the question, have you ever had a transfusion before? This gives lot of information for the nurse to assess for any anticipated side effects due to transfusion reaction. Question number 13. A client receiving a transfusion of packed RBCs begin to vomit. The client BP is 90 by millimeter mercury from a baseline of 125 by 78 millimeter of mercury. The client's temperature is 100.8 degree Fahrenheit orally from a baseline at 99.2 degree Fahrenheit. The nurse determines that client may be experiencing which complication of a blood transfusion. Option A, hyperkalemia; B, delayed transfusion reaction; C, septicemia; D, circulatory overload. So here the nurse must be expecting for the complication based on the signs and symptoms. As you've seen in the question will be option C, septicemia may increase the body temperature, also it might decrease the blood pressure. Question number 14. The nurse determines that a client is having a transfusion reaction. After the nurse stops the transfusion, which action should immediately be taken? Option A, run a solution of 5% dextrose in water. Option B, obtain a culture of the tip of the catheter device removed from the client. Option C, remove the IV line. Option D, run a normal saline at a keep vein open rate. So in case of stopping the that is in case of when the client is having a transfusion reaction, the transfusion is stopped and the nurse should make sure that normal saline is instilled for a patient at a open rate. Question number 15. The nurse has obtained a unit of blood from the blood bank and has checked that blood bank properly with another nurse. Just before beginning the transfusion, the nurse assesses which priority item. Option A, vital signs; B, skin color; Option C, urine output; Option D, latest hematocrit level. So here the nurse must assess for the vital signs whenever you are going to give transfusion for the patient. Vital sign is to be assessed priority basis. Question number 16. The nurse is listening to morning report, learns that an assigned client received a unit of granulocytes that previous evening. The nurse makes a note to assess the results of which of the following daily serum laboratory studies to assess the effectiveness of the transfusion. Option A, hemoglobin level, B, erythrocyte level, C, hematocrit level, D, white blood cell count. So here, when a granulocyte is infused for the client previous evening, the nurse must be checking for the laboratory value of white blood count to see the effectiveness of the transfusion. Question number 17. A client with severe blood loss resulting from multiple trauma requires a rapid transfusion of several units of blood. The nurse asks another health team member to obtain which device for using during the transfusion procedure to help to reduce the risk of cardiac dysarrhythmias. Option A, pulse oximetry, B, cardiac monitor, option C, infusion controller, option D, blood warming device. The right answer is the nurse should keep the blood warming device nearby the patient when he is going to transfuse several units of blood. Keeping a blood warming device will prevent the patient to get into the risk of cardiac dysarrhythmias. Question number 18. A nurse is giving a report to a nursing assistant who will be caring for a client who has hand restraint safety devices. The nurse instructs the nursing assistant to check the skin integrity of the restrained hands. Option A, every 2 hours, B, every 3 hours, option C is every 24 hours, option D, every 30 minutes. So, what you should do as a nurse to check the skin integrity of your restrained hands? The right answer is check for every 30 minutes. Is there any complication arise in the restrained hands? Particularly assessed for the blood circulation is without any disturbance or not. Question number 19. A nurse enters a client's room and finds that waste basket is on fire. The nurses immediately assist the client out of the room. What is the most important nursing action next? Option A, call for help. Option B, extinguish the fire. C, activates the fire alarm. Option D, continue the fire by closing the room door. So in this case, the nurse's action should be in activating the fire alarm. Question number 20. A post-operative client asks a nurse why it is so important to deep breathe and cough after surgery. When formulating a response, the nurse incorporates the understanding that retained pulmonary secretion in postoperative client can lead to option A, pneumonia, B, fluid imbalance, C, pulmonary embolism, option D, carbon dioxide retention. So in this case, the nurse tells that coughing after surgery and taking deep breath will prevent pneumonia. Option A is right. Question number 21. A nurse assesses a client in surgical incision for signs of infection. Which findings by the nurse would be interpreted as a normal finding at the surgical site? Option A, red hot skin, B, serous drainage, C, purulent drainage, D, warm tender skin. The right answer is assess for serous drainage that indicates it is a normal finding in the surgical site. Question number 22. A nurse is monitoring the status of postoperative client. The nurse would become most concerned with which of the following signs that could indicate a evolving complication. Option A, increasing restlessness. B, a pulse of 86 beats per minute, blood pressure of 110 by 70 millimeter of mercury. Option D, hypoactive bowel sounds in all four quadrants. So the finding which indicate the evolving of complication would be, the right answer is option A. Increasing restlessness in a postoperative client is a good indicator for a nurse to note that some complication is going to arise in a client. Question number 23. A nurse receives a telephone call from the post-anesthesia care unit stating that a client is being transferred to the surgical unit. The nurse plans to do which of the following first on arrival of the client? Option A, assess the patency of the airway. Option B, check tubes or drains for patency. Option C, check dressing to assess for bleeding. Option D, assess the vital signs to compare with preoperative measurements. So the basic priority action a nurse should do when receiving the client from post anesthesia care unit should be option A, assess for the patency of the airway. Question number 24. A client with diabetes mellitus has a glycosylated hemoglobin A1C level of 9%. Based on this test result, the nurse plans to teach the client about out the need to option A, avoid infection. B, take adequate fluids. Option C, prevent and recognize hypoglycemia. Option D, prevent and recognize hyperglycemia. So in this case, what a nurse should do? The nurse should teach the client to prevent and regulate hyperglycemia as the percentage of glycosylated hemoglobin A1C level of 9% is considered to be very high. Question number 25. A client is admitted to the hospital with an acute gout attack. The nurse expects that which medication will be ordered to treat acute gout. Option A, colchicine. Option B, allopurinol. B, probenecide. Option D, sulfame So in this case, the drug of choice for treating acute gout will be colchicine. Colchicine is the drug of choice for treating acute gout. So these are the 25 questions we have learned today through this video, and hope this will be helpful for you in giving the answers if these questions were asked in any nursing officers in your career. So this is the end of this video. Hope you all enjoyed. Thanks for watching this video that helps you to give you some extra knowledge, and please subscribe to our channel and support our channel in all the ways. Also like this video and comment about this video. If you like these two videos, please click these two videos and you can watch it. Thank you. Take care. Bye bye.